Good morning, my dear friends. I need to tell you something that might be hard to hear, but please stay with me because there's hope at the end of this story. Right now, as you watch this video, more than 6 million Americans are living with Alzheimer's disease. That number will double by the year 2050, but here is what most people do not know. Memory loss does not start suddenly. It whispers before it shouts. And if you catch those whispers early, you can often turn things around. My name is Dr. Victor Hanford, and I have spent 30 years working with older adults. I have seen patients come into my office terrified, convinced they are losing their minds, and I have watched many of them recover their sharpness, their confidence, and their joy. Today, I'm going to share 7 early warning signs of memory decline that you can actually reverse, not manage. Not slow down, reverse. These are signs your brain is crying out for help, and when you answer that cry, remarkable things can happen. Now, before we begin, I need you to promise me something. Stay until the end, because sign number 1, the last one I will reveal, is the most powerful intervention I have ever witnessed in my 3 decades of practice. It costs nothing. It requires no prescription, yet most doctors never mention it. And it can add years of clarity to your life. Let me start with a story. Last year, a woman named Helen came to see me. She was 71 years old. For 6 months, she had been forgetting where she put her keys. She would walk into a room and forget why she went there. She started avoiding conversations because she could not remember the names of her own neighbors. Helen was terrified. She told me, "Dr. Hanford, I watched my mother disappear into dementia. I cannot let that happen to me." We ran some tests, and you know what we found? Helen did not have Alzheimer's. She had 7 reversible problems that were stealing her memory. Within 4 months of fixing those problems, Helen was sharp again. She remembered everything. She started hosting dinner parties. She even learned to use a smartphone to video call her grandchildren. That is the power of catching these signs early. So let us begin. Sign number 7. You keep forgetting names of people you know well. This is different from the normal tip-of-the-tongue moment we all experience. I am talking about forgetting the name of your neighbor you have known for 10 years, or calling your grandson by your son's name over and over again. When this happens frequently, it often points to something specific. Your brain is not getting enough of a vitamin called B12. Let me explain B12 in simple terms. Think of your brain like a big city with millions of telephone lines connecting different neighborhoods. Those telephone lines are your nerves. B12 is like the protective coating on those wires. Without enough B12, the coating wears down and the signals get fuzzy. Messages do not reach their destination. Names disappear. Words vanish mid-sentence. Here is the surprising part. As we age, our stomachs produce less acid, and we need that acid to pull B12 from our food. So even if you eat plenty of meat and fish which contain B12, your body might not be absorbing it. I saw this with Robert, a 76-year-old retired teacher. He came to me frustrated because he could not remember his students' names at class reunions. It was humiliating for him. We tested his B12 levels. They were dangerously low. We started him on B12 supplements, 1,000 micrograms per day, the kind that dissolves under your tongue. Within 6 weeks, Robert told me it was like someone turned the lights back on in his mind. So what should you do? If you are experiencing this symptom, ask your doctor for a B12 blood test. If your levels are low, take a sublingual B12 supplement. That means it dissolves under your tongue, which helps it absorb better. You can find these at any pharmacy. Take 1,000 micrograms daily. It is water-soluble, so your body will simply remove any extra you do not need. And remember, we still have 6 more signs to cover, including that powerful number 1 secret that transforms brain health. So please keep watching. Sign number 6. You feel foggy and tired all day long. This is the sign people ignore the most. They blame it on getting older. They say, "Well, I am 70. Of course I am tired, but this is not normal aging. This is your brain suffocating."
Let me tell you about something called sleep apnea. It is when you stop breathing many times during the night. Your throat muscles relax and block your airway. You might not even know it is happening. But every time you stop breathing, your brain panics. It jolts you awake just enough to start breathing again. This can happen 30, 40, even 100 times per night. Imagine trying to sleep while someone shakes you awake every few minutes. You would wake up exhausted. Your brain would be in a fog all day. That is what untreated sleep apnea does. And here is the connection to memory. When we sleep, our brain washes itself. There are tiny channels that open up and flush out waste products, including a protein called beta amyloid. That protein, when it builds up, is linked to Alzheimer's disease. But if you are not sleeping deeply because of sleep apnea, that cleaning process never happens. The waste builds up. Your memory suffers. I remembered Dorothy, age 68. She told me she felt like she was walking through life in a cloud. She would read a page in a book and immediately forget what she read. Her husband mentioned that she snored loudly and sometimes seemed to stop breathing at night. We sent her for a sleep study. She had severe sleep apnea. We got her a CPAP machine. That is a small device that gently pushes air into your lungs while you sleep, keeping your airway open. 3 months later, Dorothy came back to my office. She was a different person. Her eyes were bright. She had finished 3 books. She told me, "Dr. Hanford, I did not realize how much of my life I was missing because my brain was starving for oxygen." If you snore loudly, if you wake up with headaches, if your partner says you stop breathing at night, or if you feel exhausted no matter how much you sleep, talk to your doctor about a sleep study. Treating sleep apnea can be life-changing. Now, we are about to get to sign number 5, but I want to remind you to stay with me until the end. That number 1 sign I mentioned, the one most doctors overlook, is coming. And it has helped more of my patients than anything else I prescribe. Sign number 5. You feel sad, anxious, or just not like yourself. Depression and anxiety aren't just emotional problems. They are brain problems, and they directly damage your memory. When you are depressed, your brain produces high levels of a hormone called cortisol. Think of cortisol as your body's alarm system. A little bit is fine. It helps you react to danger. But when cortisol stays high for months, it is like an alarm that never stops ringing. It is exhausting, and it actually shrinks a part of your brain called the hippocampus. That is the memory center of your brain. It is where you store new memories. I had a patient named George. He was 73. He came to me because he was forgetting appointments. He lost interest in his woodworking hobby. He stopped calling his friends. His wife made him come see me. As we talked, George told me he felt empty inside. Nothing brought him joy anymore. He thought the memory problems meant he had dementia, but I recognized the signs of depression. We started George on a mild antidepressant and connected him with a counselor. We also got him walking outside every morning. Within 2 months, George was smiling again. And guess what? His memory improved dramatically. The appointments were no longer forgotten. He was back in his workshop building birdhouses. The lesson here is simple. Your emotional health and your brain health are connected. If you feel persistently sad, if you have lost interest in things you used to love, if you feel hopeless or anxious most days, please talk to your doctor. Depression is not a weakness. It is a medical condition, and treating it can save your memory. There are also things you can do at home. Spend time with people you care about. Move your body every day, even if it is just a short walk. Get morning sunlight on your face. These simple acts help regulate your mood and protect your brain. We are almost halfway through our countdown. And I promise you, the most important sign is still ahead. Sign number 4. You have trouble finding words or finishing sentences. This is more than just a senior moment. I am talking about frequently searching for common words. You know the word. It is right there in your mind. But you cannot grab it. Or you start a sentence and halfway through, you forget where you were going. This can be a sign that your thyroid gland is struggling. Your thyroid is a small gland in your neck that controls your metabolism. Think of it as the thermostat for your entire body. It controls how fast or slow everything runs, including your brain. When your thyroid is underactive, a condition called hypothyroidism, everything slows down. Your heart rate slows, your digestion slows, and your brain slows. Thoughts become sluggish, words hide, memory fades. The good news is this is incredibly easy to test and treat. A simple blood test can check your thyroid levels. If they are low, your doctor can prescribe a small pill that you take once a day. It replaces the hormone your thyroid is not making. And often, within weeks, that mental fog lifts. I remember a woman named Patricia, age 70. She was an avid reader her whole life. But suddenly, she could not follow the plot of a simple novel. She would read a paragraph 3 times and still not understand it. She was terrified. We checked her thyroid. Her levels were very low. We started her on thyroid medication. 6 weeks later, she finished a 400-page mystery novel and told me every detail of the plot. So, if you are struggling to find words, if your thinking feels slow, if you are also experiencing weight gain, feeling cold all the time, or noticing thinning hair, ask your doctor to check your thyroid. A simple test can give you answers. Keep watching, my friends. We still have 3 more signs, and number 1 is the game changer. Sign number 3. You get confused about time or place. This is when you forget what day of the week it is. Not just once in a while, but frequently. Or you get disoriented in familiar places. Maybe you are driving a route you have taken 1,000 times and suddenly you are not sure which turn to take. This symptom often points to something surprising. Dehydration? Yes, simply not drinking enough water can cause confusion and memory problems, especially in older adults. As we age, our sense of thirst weakens. You might be dangerously dehydrated and not even feel thirsty. And your brain is about 75% water. When you are dehydrated, your brain literally shrinks slightly. It pulls away from the skull. This affects how well it functions. Dehydration also thickens your blood. That means less oxygen and fewer nutrients reach your brain. The result? Confusion, disorientation, memory lapses. I saw this with a man named Thomas, age 81. His daughter brought him to the emergency room because he was confused about where he was. He thought he was at his childhood home. He did not recognize his own daughter at first. We ran tests, fearing a stroke or dementia. But it turned out Thomas was severely dehydrated. We gave him the 4th fluids. Within hours, he was back to his normal self, joking with the nurses and asking when he could go home. The solution is simple. Drink water throughout the day. Aim for 6 to 8 glasses. If plain water is boring, try adding a slice of lemon or cucumber. Drink a glass when you wake up. Drink a glass with each meal. Keep a water bottle nearby. Also, watch out for medications that make you urinate more often, like diuretics for blood pressure. These can dehydrate you faster. If you take these medications, you need to drink even more water. Now we are getting close to the top of the list. Number 2 and number 1 are the most powerful reversible causes of memory loss I have ever seen in my practice. Sign number 2. You take multiple medications and feel more confused than usual. This is a huge problem that almost nobody talks about. I call it medication fog. Many of my patients take 5, 8, 10 or even more medications every day. Each one was prescribed by a different doctor for a different problem. Blood pressure medicine, cholesterol medicine, pain pills, sleep aids, anxiety medication, allergy pills. But here is what happens. These medications interact with each other in ways that are hard to predict. And many common medications directly interfere with memory. There is a group of drugs called anticholinergics. That is a big word. Let me break it down. These drugs block a chemical in your brain called acetylcholine. That chemical is essential for memory and learning. Block it, and your memory suffers. The scary part is that dozens of common medications have this effect. Some antihistamines like Benadryl, some medications for overactive bladder, some sleep aids, even some antidepressants. I had a patient named Evelyn, age 77. She came to me barely able to remember our conversation. Her children were begging me to put her in a memory care facility. I sat down and reviewed every single medication she was taking. She was on 12 different drugs. 4 of them had anticholinergic effects. They were all working together to shut down her memory. I worked with her other doctors. We slowly and carefully reduced her medications. We stopped the ones that were not absolutely necessary. We switched others to versions that did not affect memory. Within 3 months, Evelyn was back. She remembered conversations. She started cooking again. She did not need memory care. She needed fewer medications. Here is what you need to do. Make a list of every medication you take, including over-the-counter drugs and supplements. Take that list to your doctor or pharmacist. Ask them this exact question. Are any of these medications known to affect memory? Are there alternatives? Do this at least once a year. Medications that were helpful 5 years ago might not be necessary now. Do not stop any medication on your own. That can be dangerous. But do have this conversation with your doctor. You might be amazed at how much clearer your mind becomes when you reduce unnecessary medications. All right, my dear friends, we have reached the moment I have been preparing you for. Sign number 1. The most powerful, most overlooked, and most effective way to reverse memory decline. This is the intervention that changed everything for dozens of my patients. Stay with me. Sign number 1. You spend most of your day sitting alone. This is it. This is the big one. Loneliness and inactivity are killing your brain. Let me say that again because it is so important. Social isolation and lack of physical movement are 2 of the biggest risk factors for dementia. Bigger than genetics for most people, bigger than high cholesterol. They are silent destroyers of the mind. Here is what happens when you are lonely. Your brain stops being challenged. You stop having conversations. You stop laughing. You stop solving problems together with other people. Your brain is like a muscle. If you do not use it, it weakens. Social interaction forces your brain to work. You have to remember names. You have to follow conversations. You have to think of responses. All of that keeps your brain sharp. And loneliness triggers inflammation in your body. Think of inflammation like a fire inside your body. A little bit is fine. It helps you heal from injuries. But chronic inflammation, the kind caused by loneliness, damages your blood vessels. It damages your brain cells. It increases your risk of dementia by 60%. 60%. Now add in physical inactivity. When you sit all day, your heart does not pump as hard. That means less blood flows to your brain. Less blood means less oxygen and fewer nutrients. Your brain starts to starve. Studies show that people who sit more than 7 hours a day have a much higher risk of dementia. Even if they exercise once a day, the sitting still damages the brain. But here is the beautiful truth. You can reverse this, right now, today. Let me tell you about my patient Frank. He was 79 years old. His wife had passed away 2 years earlier. Frank spent his days sitting in his recliner, watching television. He stopped going to church. He stopped playing cards with his buddies. When he came to my office, he could barely hold a conversation. He repeated himself constantly. His daughter was in tears, convinced she was losing her father. I did not prescribe Frank a medication. I prescribed connection and movement. I told Frank to join the senior center 3 days a week. Just show up, play some cards, eat lunch with other people. I told him to walk around his block every single morning, even if it was just for 10 minutes. That is it. That was the prescription. Frank resisted at first. He told me he did not feel like it. He was too tired, too sad, but his daughter pushed him. She drove him to the senior center that first week. 3 months later, Frank walked into my office like a different man. He was smiling. He was telling me jokes. He had joined a dominoes league. He was walking a mile every morning with a new friend from the center. His memory was sharper. He stopped repeating himself. His daughter cried again, but this time from joy. That is the power of connection and movement. It is free. It requires no prescription, but it demands effort. You have to push yourself out the door. You have to say yes when someone invites you to lunch. You have to move your body even when you do not feel like it. So here is what I am asking you to do starting today. Find one social activity you can commit to every week. It could be a church group, a book club, a volunteer opportunity, a senior center, or even just coffee with a friend. Put it on your calendar. Treat it like a doctor's appointment. Do not cancel. Second, move your body every single day. You do not need to run a marathon. Walk around your house, walk to the mailbox. Dance in your kitchen, do some gentle stretches. The goal is to get your heart pumping a little bit faster and to avoid long periods of sitting. Stand up every 30 minutes, move around, your brain will thank you. And third, call someone today. Not a text, a real phone call. Hear another person's voice. Ask them about their day. Share a memory. Laugh together. Human connection is medicine for your brain. My dear friends, we have covered a lot today. We talked about 7 early signs of memory decline that you can reverse. Low vitamin B12, sleep apnea, depression and anxiety, thyroid problems, dehydration, too many medications. And the big one, loneliness and inactivity. If you recognize yourself in any of these signs, please do not wait. Do not brush it off. Do not say, I am just getting old. You deserve to live with a clear, sharp mind for as many years as God gives you. I want to leave you with this thought. I have been a doctor for 3 decades. I have seen people in their 90s with minds as sharp as a razor. And I have seen people in their 60s who have lost themselves to dementia. The difference is rarely genetics. The difference is usually the choices they made every single day.